I'm Jessica Walker and I am Director at Fit to Function in Tamworth and also Director of the Rural Women's Physio. I've been using digital health tools for a while now. We probably launched into it to more of a degree after COVID. To implement digital health to begin with was challenging. In and around that COVID period, there weren't a lot of tools available. And it was difficult in the health space in terms of a medico-legal framework. Quite challenging, but the platforms are much better serviced now. So your video conferencing and telehealth platforms are actually integrated with our practice management systems. The first steps I took to improve digital health was definitely trying to develop the resources behind that. So I wanted to expand my reach and access for rural and remote women more than anything. That was my desire and my passion project, I suppose, and the reason why I really started looking into digital health platforms. Fit to Function in Tamworth, we use it mainly as a follow-up tool. So we do outreach clinics. And I guess that's the difference with physiotherapy. So physio is a very physical and practical profession. A lot of times we just can't avoid doing a physical examination. So in our bricks and mortar practice, we certainly use it much more as a follow-up tool. In terms of the Rural Women's Physio, I actually use like a triaging-like system so that I can figure out which clients are going to be able to move straight onto my course content as such, and which of those that I do need to have a video telehealth consult with, and also then which of those I really need to see face-to-face. Telehealth has allowed us to make outreach programs and our services that we offer for our rural and remote clientele really sustainable. It's allowed us to be more efficient with our time. It's taken that travel and a lot of the costing out of play while still being able to allow access to those communities that really need it. Digital health has really helped us be able to deliver our services further and wider throughout our New England region. Probably the biggest benefit that I've seen from being able to integrate digital health into our practice is just the access point. And so I know that comes more so from the communities. So I feel like our rural and our regional communities are getting more access. Our remote communities are definitely getting more access to specialised help without the big burden that comes with having to travel for that. And having to be innovative and think of other ways to be able to deliver healthcare has allowed our business to become less dependent on time for money, less dependent on having to travel to reach other clientele. It's increased our clientele base, but it's also helped us become a little bit more scalable as well. We've been able to turn parts of our service into a product, which is very uncommon in a service-based industry. So the biggest digital health tools that have had the biggest impact on us as a business here in Tamworth and our Fit to Function, our bricks and mortar, is definitely the integration of the telehealth functions into our practice management system. It just makes it very streamlined and very easy to use to be able to ensure that you could offer a service that was just as good as, if not maybe better in some instances, to a consultation that you could offer face-to-face. I would recommend other practitioners just start. Don't let perfection get in the way of progress. It does feel different. We're very used to having face-to-face conversations. We are very used to be doing all of our assessments. So if we want to serve these communities, we need to have passion to serve them, but we need to make sure that it's also viable for the businesses, the small to medium enterprise, that are actually going to think outside the box and be innovative to reach these clientele. So those extra programs have definitely made a big difference in those instances.